this is the Gas Therapeutics Lab Final Station 1. So this is the nebulizer setup. So you're going to do the whole knock knock. Hi, my name is Lauren. I'm from respiratory. I'm going to wash my hands and glove up. You guys are actually going to put on gloves. So I will have those out. And then once your gloves are on, if you want, you can do your patient assessment portion first before your equipment's set up. So on the monitor on the wall that's in front of me here, it will have your heart rate, your respiratory rate, and your SpO2. So you'll write all that down on a chart that I will give you guys, and then you will also listen to breath sounds on the mannequin. So remember, we listen to up here and here for upper breath sounds, and then at least on each side, kind of right below your armpit, for your 4 minimum places that you should be listening to breath sounds. There are up to 16 different places that you can listen to, including the front and the back. But those are at least the 4 minimum. Once you've done that part, let's see. Okay, yes, then you're going to assemble your equipment. So as you can see here on the table, this is what you guys will have for your equipment. So this is all the pieces to your nebulizer, and then of course your oxygen or air line. So to set this up, you have your little cup. This little green piece just sits right in. Then the cap part just screws on. Then your T piece goes on top of that. Then you have your corrugated tubing, which goes on the larger side. It's kind of hard to tell, but this side is fatter than this side. So this goes on, it goes on the skinnier side. And then your mouthpiece goes on this side. If you were just going to use an aerosol mask, you would just remove this whole portion and just attach the mask directly to your cup. And then, once this is all assembled, you take your line and you plug it in to the bottom here. And you kind of want to shove it on there good, make sure it's nice and secure. And then of course, the other side attaches to the little Christmas tree on your flow meter. So once you have that part attached to your flow meter on the wall, this is all set up correctly, then you're going to take one of those little saline bullets. I don't have a little one, I forgot to grab it. This is a really fat one, but you'll take one of the skinnier ones as your like pretend albuterol or Duoneb, whatever med you're giving to your patient. And you'll put it in your nebulizer. Again, you can put your med directly in the top here, or some people prefer to unscrew it. Both ways work. I like to do it this way. So normally you would do the whole thing with an actual ampule of medication, but with these ones, just do a little bit, enough that when you turn it on, it'll mist. So once your medication is in there, you're going to turn your flow meter on to about 8 liters. And you can see I have a nice plume. So once you show me that you've got your plume going, then you'll stop your treatment. Do a post-treatment vitals check. That includes your heart rate, your respiratory rate, your oxygenation, and your breath sounds. And then, oh yes, you will discard your PPE. So once this is all done, then you're going to show me that you know how to take your gloves off. So remember, you kind of pinch your wrist, or pinch the wrist of your glove, and turn it inside out. Then ball this glove up in your other hand. Again, try not to touch the outside of your glove. inside out and take it off and discard it. And that's the end of your first station.